About hormonal imbalance. So please, if this is your first time of coming across my channel, please subscribe, like, comment and share. Thank you. So I'll be talking about hormonal imbalance today. If you are facing the challenges of hormonal imbalance, come closer because this topic is for you. So what are hormones? Hormones are chemicals that coordinate different functions in your body by carrying messages through your blood to your organs, skin, muscle and other tissue. These signals all your body parts, or this tells your body what to do and when to do it. Hormones are essential for life and your health. Scientists have identified over 50 hormones in the human body so far. Hormones are most of the tissue's many glands that create and release them, make up your endocrine system. So, example of the hormones are metabolism, metamorphosis, constant internal balance. So, these are the things that make up the hormones in our system. What is hormonal imbalance? A hormonal imbalance happens when you have too much or too little of one or more hormones. It's a broad term that can represent many different hormones related conditions. Hormones are powerful signals for many hormones. Having even slightly too much or too little of them can cause major changes to your body and lead to certain conditions that require treatment. Some hormonal imbalance can be temporary, while others are chronic in conditions such as hormonal imbalances. In addition, some hormonal imbalances require treatment so you can stay physically healthy, while others may not require your health but can negatively affect your quality of life. What conditions are caused by hormonal imbalance? What conditions are caused by hormonal imbalance? Dozens of medical conditions are caused by tissue. Much or too little of them causes issues with your health. While many of these imbalances require treatment, some can be temporary and may go away on their own, while some of them most common hormone related conditions include irregular menstruation. And I see those joining me. Thank you very much. Thank you very much. Thank you very much for joining me. Thank you. Please, if you're hearing me, give me a thumbs up. Like my video if you're hearing me so that I will continue. Common hormone related conditions are: number 1, irregular menstruation. Irregular menstruation. Several hormones are involved in the menstrual cycle. Because of this, an imbalance in any or one of the several of those hormones can cause irregular periods. Specific hormone related conditions that cause irregular period include polycystic ovarian syndrome, infertility. Hormonal imbalance are the leading cause of infertility in people assigned female at birth. Hormone-related conditions such as PCOS and ovulation can cause infertility. People assigned male at birth can also experience hormonal imbalance that affect fertility, such as low testosterone, Low testosterone level. Acne. Acne is primarily caused by clogged pores. While many factors contribute to development of acne, hormone fluctuation, especially during puberty, are a significant factor. Oily glands, including those in the skin or on your face, get stimulated when hormones become active during puberty. So, done. Hey, can I please be pinned? Yes, I've done that. Thank you. So we are talking about hormonal imbalances. Our today's topic is talking about hormonal imbalances. So let me continue. Hormonal acne, adult acne. Hormonal acne develops when the hormonal changes increase the amount of oil your skin produces. This is especially common during pregnancy, menopause, and for people who are taking testosterone therapy. Another one is diabetes. In the United States, most common endocrine condition is diabetes. In diabetes, your pancreas doesn't make enough of the hormone insulin in your body, doesn't use it properly. There are several different kinds of diabetes. The most common are type 2 diabetes, type 1 diabetes, and gestational diabetes. Hope you're hearing me. Please, if you're hearing me, say something in the comment section. Let me know you're hearing me. We're still talking about hormonal imbalance. Thyroid disease. The two main types of thyroid disease are hypothyroidism, low thyroid hormone levels, and hyperthyroidism. High thyroid hormone levels. Each condition has multiple possible causes. Thyroid disease requires treatment. Obesity. Many hormones can affect how your body signals that you need food and how your body uses energy. So, an imbalance of certain hormones can result in weight gain in the form of fat storage. For example, excess cortisol, a hormone, and low thyroid hormones, hypothyroidism, can contribute to obesity. Symptoms and causes. What are the signs and symptoms of hormonal imbalance? What are the signs and symptoms of hormonal imbalance? Because your body makes over 50 different hormones, all of which contribute to important bodily function, you could experience several different symptoms depending on which hormone imbalance you have. It's important to know that many of the following symptoms could be caused by other conditions, not just from a hormonal imbalance. If you ever notice a change in your day-to-day health and are experiencing new persistent symptoms, it's important to talk to your health care provider, no matter what you think the cause might be. Hormone imbalance symptoms that affect your metabolism. Common hormonal imbalances include those that affect your metabolism. Your metabolism consists of chemical reactions in your body cells. They change the food you eat into energy. Many different hormones and processes are involved in metabolism. Symptoms of hormonal imbalances that affect your metabolism include slow heart or rapid heartbeat, unexplained weight gain or weight loss, fatigue, constipation, diarrhea or more frequent bowel movements, numbness and tingling in your hands, higher than normal blood cholesterol level, depression or anxiety. being unable to tolerate cold temperature or warm temperature, dry, porous skin and hair, thin, warm and moist skin, irregular body fat distribution, darkened skin in your armpit or the back and sides of your neck, skin tags, small growth on your skin. That's what we call skin tags, small growth on your skin or on your face. Extreme test and frequent urination. Okay, so these are the symptoms of hormonal imbalances in your system. If you notice any of these, know that you're having a hormonal imbalance. So, sex hormone imbalances symptoms for people assigned female at birth. People assigned female at birth can have imbalances of the sex hormone estrogen and progesterone, which the ovaries produce. They can also have excess testosterone and androgens. An imbalance in sex hormone can cause the following symptoms in the people assigned female at birth. Okay, acne on your face, chest or upper back, hair loss, heavy period, excess body hair, hot flushes, infertility, irregular periods, loss of interest in sex, vaginal atrophy, vaginal dryness. So these are the symptoms of hormonal imbalance in females. These ones I mentioned now are the symptoms of hormonal imbalance in females. Like I said before, acne on your face is a sign of hormonal imbalance. Hair loss is a sign of hormonal imbalance. Heavy periods is a sign of hormonal imbalance. Excess body hair. Some people start growing hair on their chin, yes, on their chest. Excess body hair is a sign of hormonal imbalance. Hot flashes is a sign of hormonal imbalance. Infertility is a sign of hormonal imbalance. Irregular periods is a sign of hormonal imbalance. Loss of interest in sex is also a sign of hormonal imbalance. Vaginal atrophy is also a sign of hormonal imbalance. Vaginal dryness is also a sign of hormonal imbalance. So if you are experiencing all these things I mentioned here, they are signs of hormonal imbalance. Go get yourself checked. Do hormone profile test to know which of the hormones are too much or too little, so that you start medication to normalize them. So let's assume you are finding it difficult to get interest in sex. You are no longer having interest in sex, no sex drive again. That might be a cause of hormonal imbalance. If you are trying to conceive and you're not getting pregnant, check your hormones, make sure they are normal. Irregular periods is also a sign of hormonal imbalance. So if you're having irregular periods, get yourself checked. Infertility, acne on your face, chest and upper back, excess hair loss or excess body hair, that are also sign of hormonal imbalance. Sex hormone imbalancing symptoms for people assigned male at birth. People assigned male at birth can have an imbalance of testosterone, which the testes produce, and the other sex hormone, which can cause the following symptoms. These ones are for males. Symptoms of hormonal imbalance in males: decrease or loss of body hair, erectile dysfunction, infertility, loss of interest in sex, loss of muscle mass. So if your man is having all these symptoms I mentioned here, or any of them, let him get some tests. Or if your husband is having such symptoms like decreased body hair or excessive body hair, enlarged breast. If your man is growing breast, it might be a sign of hormonal imbalance. loss of muscle mass, loss of interest in sex. They are all signs of hormonal imbalance. Can hormone imbalance cause weight gain? Yes, hormonal imbalance can cause weight gain. Hormonal imbalance can cause weight gain. Okay. Certain hormone imbalance can cause weight gain, including hypothyroidism. This condition happens when you have low levels of thyroid hormone, which causes your metabolism to slow down. This can cause weight gain. Okay. Menopause. During menopause, many people assigned female at birth gain weight due to hormonal changes that cause their metabolism to slow down. It's important to remember that this type of hormonal imbalance is natural and the expected part of life. So you don't have to worry about these ones because they come naturally. Several other factors contribute to weight gain. If you are experiencing unexpected weight gain or are concerned about your weight, talk to your healthcare provider. Can hormone imbalance cause anxiety? Can hormone imbalance cause anxiety? Yes, certain hormone imbalances can cause anxiety, including hypothyroidism. If you have hypothyroidism, it means your body has too much thyroid hormone. Excess thyroid hormones speed up your metabolism. This can cause anxiety in addition to unusual nervousness, restlessness, and irritability. Okay. Adult onset growth hormone deficiency. Adults with growth hormone deficiency often report having anxiety or depression. Several other conditions and factors can cause anxiety. It's important to talk to your healthcare provider if you are experiencing anxiety. Thank you for those joining me. Thank you. I can see you guys. Thank you for supporting me. So let's continue. What causes hormonal imbalances? Throughout your life and even throughout the day, your hormone level naturally rise and fall. Throughout your life and even throughout the day, your hormone levels naturally rise and fall. Certain periods of life okay. In certain period of excuse me. So what causes hormonal imbalance? Throughout your life and even throughout the day, your hormone levels naturally rise and fall. Certain period of life cause more dramatic changes and fluctuation in hormones, including puberty, pregnancy, menopause. However, there are several other reasons why your hormones level may be irregular at unexpected times. Some of the most common cause of fluctuating in imbalances hormone level include stress, certain medication, steroid use. These hormonal imbalances are more likely to be temporary or fixable with a change in medication or properly managing stress. Chronic hormone-related condition can have several different possible causes. In general, the main condition or situation that cause medically significant hormone imbalances include tumors or other growth, damage or injury to an endocrine gland, autoimmune conditions. So tumors are rare endocrine tumors form in glands or in cells that produce hormones and can cause hormone imbalances. Some of the rare endocrine tumors include an increase in the thyroid gland. Hello, please, if you are hearing me, say something. Say hi on the comment section. Let me know you're hearing me. Someone should say hi at the comment section. Let me know that my video has value. Please, are you guys hearing me? Okay. Diagnosis and tests. How are hormonal imbalances diagnosed? Healthcare providers typically orders blood tests to check hormone levels. Since your endocrine glands release hormone directly into your bloodstream, certain hormone levels vary drastically throughout the day. So, providers may order other tests to measure your levels, such as a glucose tolerance test or insulin tolerance test. Your provider will also ask you about your medical history and symptoms and perform a physical exam. Management and treatment. How are hormonal imbalances treated? Treatment for hormonal imbalances will depend on what's causing it. If you have lower than normal hormone levels, the main treatment is hormone replacement therapy. Depending on which hormone is deficient, you may take oral medication or pills or injection medication. For example, if you have low thyroid hormone levels, hypothyroidism, your provider can prescribe synthetic thyroid hormone pills. If you have growth hormone deficiency, you will likely to take injection shots of synthetic growth hormone. If you have higher than normal hormone levels, there are many treatment options depending on the cause. Options include medication, surgery, radiation therapy, or a combination of any of these. For example, if you have a high prolactin, tumor that causes excess prolactin, your provider may prescribe a medication to shrink the tumor, or you may need surgery to remove it. How do you fix hormonal imbalances? Many health conditions that involve hormone imbalances, such as diabetes and thyroid disease, require medication. So, many nutritional supplements in stores claim to treat different hormonal imbalances, but few of them have been scientifically proven to have a beneficial effect. It's important to always talk to your healthcare provider first about taking supplements. Aside from medical treatment, your provider may recommend certain lifestyle changes to help manage a hormonal imbalance, such as managing your stress level and getting routine exercise. What kind of doctors treat hormonal imbalances? Primary healthcare providers can diagnose and help you manage your hormone imbalances, but you may benefit from seeing an endocrinologist. An endocrinologist is a healthcare provider who specializes in endocrinology, a field of medicine that studies conditions related to your hormones. They can diagnose endocrine hormone condition, develop treatment and management plans, and prescribe medication. So, How can I prevent a hormonal imbalance? How can I prevent a hormonal imbalance? Why many hormonal imbalances aren't preventable? There are certain things you can do to optimize your overall health, which could help keep your health hormones balanced, including maintaining a healthy weight, eating a balanced and healthy diet, exercising regularly, managing your stress, getting enough quality sleep, managing your chronic health conditions if applicable, quitting smoking or using tobacco, living excuse me guys. So guys, thank you for joining me on today's class. Please, if this is your first time of coming across my channel, please subscribe, like, comment and share. Thank you for joining me. Good night. We are about to close. Thank you for joining me. We talked about hormonal imbalances. We talked about symptoms of hormonal imbalances. We talked about treatment of hormonal imbalances. We talked about necessary tests to run if you are experiencing hormonal imbalances. So please, if you are experiencing vaginal dryness, low sex drive, infertility, anxiety, this could be that your hormones are imbalanced. Either your hormones are too high, some of your hormones are too high or too low. So get tested to get a proper treatment. Thank you very much. Please remember to subscribe, like, comment and share. Thank you. Bye.